Hello and welcome. I am Marwan Aburas, and in this presentation, we dive into one of the most critical yet commonly misunderstood steps in endodontic diagnosis, response testing. And that is the R3 step in my 4R operational diagnosis protocol. This step is where clinical intuition meet biological science. But there is a truth. The traditional pulp tests have been misused, misunderstood, or applied without critical thought for decades, with little connection to the actual testing or assessing of the pulp health status. That's why this module is different. It's designed to empower you, the practitioner, with clinical clarity, biological relevance. Yes, biological relevance. We begin first with the electric pulp tester, also known EPT, a tool that once dominated the diagnostic stage, but does it truly measure the pulp vitality, viability, or just a nerve response? In this presentation, I examine its value and its limitations based on decades of a clinical observation and scientific scrutiny. Next, the heat test, HPT, completely misunderstood, often abused or poorly used. You will see what raising the pulp temperature 3 degrees, 5 degrees, or 10 degrees does. And it will also show you when heat test really can be used. Only in cases where we have a previous endodontic treatment and we're suspecting an untreated canal. Then comes the pulp test, CPT, the cold test, the method I rely on in my clinical decision making. Because when it is applied correctly, cold testing, especially with carbon dioxide snow, provides fast, reliable, and biologically meaningful results. But remember, every diagnostic test has its limitations. And that's why, as endodontic clinicians and endodontic educators and dental educators, we must pay attention to the broader context of endodontic diagnostics, which include the patient narrative, insight from the radiographs, and the story of the pulp within the overall context of the story of the tooth. That's exactly, my friends, what I proposed back in 1980s with the stress pulp concept, which I will use, and I'm still using in my practice. And I refer to it the STP, the stress pulp test. Then in the presentation comes the fistula and sinus tracts, which are really a very valuable allies in endodontic diagnosis and treatment. Here, you will understand what oral fistulas and sinus tracts, also known as gumboids by the patients, are. These drainage pathways in the oral mucosa or the gingival tissue can become your strongest diagnostic friend and allies. They show you the source of infection, they track it, they confirm accurate diagnosis by closure and healing. And then finally, we visit the periodontal examination and tests, the cornerstone in diagnosis of every clinical discipline. However, it is especially needed and powerful in endodontics. Understanding periodontal diagnosis is crucial in endodontic treatment because periodontal disease not only causes endodontic disease, but it's also responsible for more than 30% of endodontic treatment failures. This module is not about testing, it's about thinking biologically, interpreting behaviorally, and acting with clinical confidence. Clinical confidence. And that's what the 5 presentation in the R3 step module deliver. And that's what I have proposed for you. Okay? Let's get started and elevate, enhance your diagnostic power. More meaningful responses at a time, one by one. Thank you for listening.